In the fast-paced realm of healthcare, where patient care meets operational precision, the clinical coordinator emerges as a pivotal figure. This role bridges clinical expertise with administrative oversight, ensuring medical facilities run seamlessly while prioritizing patient outcomes. The job description of a clinical coordinator blends leadership, organization, and a deep understanding of healthcare systems. Let's delve into what this position entails, the skills it demands, and why it's a cornerstone of quality care. What does a clinical coordinator do? A clinical coordinator oversees the daily operations of a healthcare unit, be it a hospital ward, outpatient clinic, or specialized department. They manage staff, coordinate patient care, and ensure compliance with regulations, acting as the glue between medical teams and administrative goals. Unlike frontline clinicians who treat patients directly, coordinators orchestrate the environment where that care happens. Think of them as the conductor of a healthcare symphony, guiding nurses, doctors, and support staff to play in unison. They ensure schedules align, resources are available, and patients move smoothly through the system, all while keeping quality at the forefront. Core responsibilities in focus. The job description of a clinical coordinator adapts to the setting but centers on key duties. Here's what they typically manage. 1. Staff coordination. They schedule shifts, assign tasks, and train personnel, ensuring the team is staffed and skilled to meet patient needs. 2. Patient flow management. Overseeing admissions, discharges, and transfers, they keep beds turning and wait times short. 3. Resource oversight. From ordering supplies to managing equipment, they ensure clinicians have the tools to work effectively. 4. Quality assurance. Monitoring care standards, reviewing protocols, and addressing complaints, they uphold safety and satisfaction. 5. Regulatory compliance. They enforce health laws, like HIPAA, and prep for audits, keeping the unit legally sound. These tasks highlight the clinical coordinator's role as a multitasker, balancing people, processes, and policies with finesse. Skills that define the role. To excel as a clinical coordinator, a robust skill set is essential. Leadership stands out. They guide teams with authority and empathy, resolving conflicts or boosting morale. Organizational prowess is key. Juggling schedules, inventories, and patient loads demands a sharp eye for detail. Clinical knowledge, often from nursing or allied health routes, grounds their decisions, letting them speak the language of care. Communication bridges gaps, whether briefing staff or calming a worried family. Problem-solving seals it. They tackle staff shortages or equipment glitches with quick, smart fixes. A day in the life. Let's follow Maria, a clinical coordinator in a hospital's emergency department. Her day starts at 7 a.m. with a huddle. Last night's surge left staff stretched, so she reassigns a nurse from triage to beds. By 8, she's checking inventory. IV fluids are low, so she orders more. At 9:30, a patient backlog builds. Maria reshuffles priorities, speeding discharges to free space. Midday, she trains a new hire on charting, then reviews a safety report. Hand washing slipped, so she plans a refresher. At 2 p.m., a family complains about delays. Maria listens, explains, and adjusts flow. By 4, she's prepping for an audit, ensuring records align with regs. She leaves at 5, the steady thanks to her steady hand. Challenges and rewards. The role has its trials. Pressure peaks. Maria's backlog fix wasn't easy amid chaos. Emotional strain hits. 2. Upset patients or burned-out staff tug at her resilience. Long hours stretch thin. Audits or emergencies can delay her exit. The weight of responsibility, lives hinge on her unit's function, looms large. Yet rewards abound. Seeing a patient leave healthier, thanks to her team's work, lifts Maria's spirits. Mastery grows. Each crisis sharpens her skills. The role's impact, smoothing care for dozens daily, offers deep satisfaction, plus solid pay and a path to climb. Why clinical coordinators matter. Clinical coordinators are the heartbeat of healthcare efficiency. Without them, staff flounder, supplies dwindle, and patients languish. Maria's backlog tweak kept the from buckling. Her training ensures errors drop. They're the unsung architects of care, making sure every piece, human or material, fits, driving outcomes that save lives. Midway through her tenure, the job description of a clinical coordinator shines when a flu wave hits. Admissions spike, but Maria rallies her team, secures extra beds, and keeps chaos at bay. Her foresight holds the line, proving coordinators are linchpins in crises. Pathways and opportunities. Entering this role often starts with clinical roots. Many, like Maria, are RNs with a bachelor's, though some rise from tech or admin roles. Experience trumps all. Years bedside or in ops pave the way. Certifications, like in management or informatics, boost creds, while an MHA or MSN opens higher doors. Growth beckons. Maria could aim for director, operations manager, or specialize in quality control. Skills, leadership, systems thinking, transfer to consulting or policy, making the role a springboard with legs. How does context shape the role? The clinical coordinator's gig flexes by venue. In it's chaos control, fast pace, high stakes. In clinics, it's steady flow, appointments, follow-ups. In labs or rehab, it's precision, equipment, schedules. The core holds: coordinate, optimize, care. This adaptability keeps the role vital across healthcare's sprawl. Technology's role: tech fuels the gig. Maria uses EHRs to track patients, software to roster staff, and apps to order supplies. Telehealth might mean virtual check-ins, dashboards flag bottlenecks. Basic mastery, navigating systems, reading data, is now table stakes, streamlining work but upping tech demands. Conclusion: the clinical coordinator is the quiet maestro of healthcare, weaving order from complexity to put patients first. They lead, tweak, and troubleshoot, often unseen, always essential. From Maria's to countless units, their work proves coordination is care's backbone. This role, blending grit and grace, merits a spotlight, whether in text or on screen.